Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Point 7 Trigger Finger SelfCare Remedies Trigger finger can limit finger movement and make it difficult to straighten and bend the affected finger. This condition results from inflammation of the tendons that flex the fingers, causing pain and tenderness. Tendons are connective tissues that attach muscles to bone. /r/n/r/n trigger finger needs treatment, or it will get worse. Advanced symptoms include the affected finger getting locked in a bent or straight position. The ring finger and thumb are the most commonly affected digits, but the condition can affect any finger. When the thumb is affected, the condition is called trigger thumb. /r/n/r/n This article explains the nonsurgical, at-home treatment options, including splinting, hand and finger exercises, and heat therapy, which might help you avoid surgery. /r/n/r/n Jorge Aguado Martin, Getty Images /r/n/r/n Trigger finger and trigger thumb are sometimes called stenosing Tenosynovitis. Tenosynovitis is inflammation of a tendon in its synovial sheath, covering. /r/n/r/n The causes of trigger finger are not always known. The condition is sometimes linked to medical conditions like rheumatoid arthritis, RA, and diabetes. Local trauma, injury, to the palm or base of the hand can also lead to the condition. /r/n/r/n Symptoms of trigger finger include /r/n/r/n symptoms may be worse first thing in the morning but will improve as the finger starts to relax. /r/n/r/n The article explains the non-surgical, at-home treatment options, including splinting, hand and finger exercises, and heat therapy, which might help you avoid surgery. /r/n/r/n One of the easiest ways to treat and manage pain and symptoms from a trigger finger is rest. Resting the hand and finger can often reduce your symptoms. /r/n/r/n It is essential to give your finger time to heal, which could take several weeks. Rest your affected hand and finger as much as possible until the swelling improves and you can bend the finger again. /r/n/r/n Any overexertion can damage the finger joint, which could lead to joint, tendon, or nerve damage. /r/n/r/n Use a splint over the affected finger to hold it in place in a straight position. Splinting helps to reduce strain, twisting, or bending of your affected finger. Movement can lead to tissue damage and prolong your recovery time. /r/n/r/n Trigger finger also causes the affected finger to be incredibly stiff in the morning, so splint therapy can help reduce morning stiffness. /r/n/r/n Splinting for 6 to 9 weeks can allow for gradual improvement, according to a 2020 Journal of Primary Care and Community Health report. This is especially important while you sleep because this is the time when you are unaware of your finger placement. /r/n/r/n The best hand and finger exercises for trigger fingers are those that improve flexibility. When the tendons of the finger joints are flexible, movement of the affected finger becomes easier, and symptoms like pain, stiffness, and joint locking are reduced. Regular movement of the fingers can also keep them from locking up. /r/n/r/n The American Society for Surgery of the Hand recommends the following hand and finger exercises. /r/n/r/n Tendon glides are stretches that help mobilize the tendon along the fingers, decrease tension, and improve movement. For this exercise, keep the wrist straight. Completing all the steps counts as one repetition. /r/n/r/n The distal interphalangeal (DIP) joint is the finger joint closest to your fingertip, just before the nail starts. This is the joint closest to your fingertip. /r/n/r/n The dip joint blocking exercise can isolate the affected joint in the finger or thumb to restore strength and prevent further problems. It can also provide relief from pain, stiffness, and locking. /r/n/r/n. You will want to exercise one finger at a time for the dip joint blocking exercise. /r/n/r/n. The proximal interphalangeal joint is the joint of the finger nearest the palm. It bends and extends and can quickly become stiff following an injury. /r/n/r/n. Exercise one finger at a time, as follows. /r/n/r/n. Wrist flexion involves bending the hand down at the wrist so the palm faces the arm. It is part of the normal range of motion of the wrist. /r/n/r/n. Extension involves moving the hand backward so the palm is facing up. It is also a normal part of the wrist's range of motion. /r/n/r/n. If wrist flexion and extension are impaired, you may have trouble with daily tasks involving the hand and wrist. /r/n/r/n. With the wrist flexion and extension exercise. /r/n/r/n. Wrist circumduction involves moving the wrist in a circular motion. This is similar to the exercise called alphabet writing. /r/n/r/n. Do 2 sets of 15 repetitions for each of the above exercises, 2 to 3 times a day. /r/n/r/n. Heat therapy, such as using a moist heating pad or soaking the affected finger in warm water, can help alleviate stiffness and pain related to the trigger finger. Heat can also increase blood flow. /r/n/r/n. Soaking the affected finger in warm water, especially when symptoms first start, can ease them. The warmth will dilate blood vessels and improve blood flow to reduce inflammation and stiffness. /r/n/r/n. Massage may help unlock a trigger finger. To massage the affected finger, apply gentle pressure and a circular motion at the affected knuckle and the base of the finger on the palm side. /r/n/r/n. You will also want to massage the fingers, hand, wrist, and forearm connected to the affected finger. You can follow the massage with hand and finger stretches. /r/n/r/n. Adaptive tools can help reduce the symptoms of trigger finger, including friction and inflammation. Such aids include soft grip tools for use at home and work, altered handle tools, padded gloves, assistive kitchen devices, and splints. /r/n/r/n. Over-the-counter, OTC, oral non-steroidal anti-inflammatory drugs, NSAIDs, including Advil, ibuprofen, and Aleve, naproxen, and topical pain relievers are first-line treatments for mild trigger finger. /r/n/r/n. Voltaren, diclofenac, gel is a commonly used OTC topical anti-inflammatory that works by blocking cyclooxygenase, COX, an enzyme that promotes inflammation. /r/n/r/n. Anti-inflammatory oral medications and topicals can help reduce pain and inflammation. When inflammation is improved, the ability to move the affected finger gets better. /r/n/r/n. A healthcare provider can prescribe stronger oral and topical pain relievers for severe trigger finger. Topical and oral pain relievers can be combined with other therapies, including splinting and hand and wrist exercises. /r/n/r/n. Trigger finger will not go away on its own. It typically gets worse without treatment. Fortunately, most people can manage their symptoms with anti-inflammatory medicines and other conservative therapies. /r/n/r/n. If you are able to manage symptoms with self-care, the trigger finger will heal. However, if conservative therapies fail, your healthcare provider will recommend seeing a hand specialist who may recommend surgical treatments. /r/n/r/n. Corticosteroids can be injected into the tendon sheath at the base of the affected finger. In most cases, the injection can resolve the condition quickly and completely stop symptoms. /r/n/r/n. If symptoms do not improve with the first injection, a second one can be given. If 2 injections do not help, surgery is often the next step. /r/n/r/n. Corticosteroid injections, also called steroid injections and cortisone injections, can be injected into the tendon sheath at the base of the affected finger. In most cases, the injection can resolve the condition quickly and completely stop symptoms. /r/n/r/n If symptoms do not improve with the first injection, a second one can be given. If 2 injections do not help, surgery is often the next step. /r/n/r/n If you try non-surgical treatment and the trigger finger does not resolve, your healthcare provider will recommend surgery. They may also recommend surgery if the finger becomes permanently bent or locked or after 2 failed corticosteroid injections. /r/n/r/n The primary purpose of surgical treatment is to release the tissues in the area located at the base of the finger so the tendon can move gently and freely. This procedure is called a trigger finger release. /r/n/r/n If you still have symptoms after a trigger finger release, a flexor tenosynovectomy might be recommended. That surgery removes the thickened lining from the tendon surface. If symptoms continue further, part of the superficial tendon can be removed to reduce the tendon's volume. /r/n/r/n The superficial tendons help to bend the index, middle, finger, and small fingers at the middle joint. /r/n/r/n Engaging in trigger finger exercises can help you to relieve pain and keep the condition from worsening. /r/n/r/n Different wrist stretches can help manage trigger finger symptoms and prevent them from getting worse. /r/n/r/n Clenched wrist bend, /r/n/r/n Side to side wrist bend, /r/n/r/n The fingertip bend is an easy exercise that targets the finger joint of the affected finger, as follows, /r/n/r/n This middle joint bend may improve pain and flexibility in the pip joint, /r/n/r/n The palm strength helps to stretch the fingers and wrist. /r/n/r/n The ball squeeze uses a small ball to stretch and strengthen the fingers. /r/n/r/n Trigger finger is a painful condition that can cause your finger or thumb to catch or lock when you bend it. It can affect any finger, but it frequently affects the ring finger or thumb. Trigger finger is also called stenosing Tenosynovitis. /r/n/r/n You can manage mild cases of trigger finger with rest, heat, stretching, OTC pain relievers, and splinting. The most effective non-surgical treatment for trigger finger is a corticosteroid injection, and most people can get relief with a single shot. Others may need a second shot for long-term or complete relief. /r/n/r/n Trigger finger will not go away without treatment. If it worsens or is untreated, it can lead to limited finger motion. In these cases, surgery will be needed to treat the condition and return function and motion to the affected digit. /r/n/r/n You might be able to manage and prevent symptoms of trigger finger with wrist, hand, and finger exercises. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.